How common is nail fungus, also called onychomycosis? In this video, we'll look at the numbers, why they vary, and what they really mean. Before we talk statistics, it helps to know what actually counts as a case. Some studies rely on self-reported symptoms, which tend to overestimate. Others use doctor diagnosis. The strictest studies confirm with lab tests like cultures or PCR, and those numbers usually come out lower. This difference is one reason prevalence estimates vary. Worldwide, nail fungus affects about 5 to 10% of the population. A commonly cited midpoint is around 5.5%. That range depends on the type of study and how cases are confirmed. In Europe and North America, population studies show around 4%, but in clinics and hospitals, the rate is almost 9%. That's because people with noticeable symptoms are more likely to show up in medical settings. Among all nail problems seen by doctors, about half turn out to be fungal infections. That makes onychomycosis the single most common nail disease. The older you are, the higher the chance of nail fungus. In people over 65, rates can reach 35%, and some studies suggest close to 50% in those over 70. Slower nail growth and cumulative exposure explain a lot of this increase. Other risk factors also raise the odds. Diabetes and circulation problems make nails more vulnerable. Having athlete's foot nearby increases the chance it spreads to nails, and environments like gyms, pools, or just wearing tight shoes can set the stage for infection. Not every thick, yellow nail is caused by fungus. Conditions like psoriasis, eczema, or even trauma can look similar. That's why many studies confirm cases in the lab to separate true fungal infections from lookalikes. On the flip side, many people with nail fungus never see a doctor. They might self-treat or simply ignore it if it's mild. That means real-world prevalence could be higher than strict lab-confirmed numbers suggest. To recap, globally, 5 to 10% of people have nail fungus. In Europe and North America, about 4%. Clinics see nearly 9%. Prevalence shoots up in older adults, and fungus makes up half of all nail disease cases. So why do these numbers matter? Nail fungus might start as a cosmetic issue, but for many people it becomes more than that. Thick, brittle nails can cause pain in shoes or while walking. In older adults or people with diabetes, it can lead to secondary bacterial infections, which can be serious. Even mild cases often affect confidence. Some people avoid open-toed shoes or social situations because of it. And since prevalence rises sharply with age, this isn't a small niche problem. It's one of the most widespread nail conditions worldwide. That's why recognizing how common it is matters, both for personal health and for public health. If you'd like to learn more about your own nail health, we've included a quick nail health quiz in the description. It only takes a minute and can help you see if a supplement might be a good fit for you.